Hi, it's Amy. I'm going to do my postpartum assessment. Knock, knock, knock. Hi, Jane. My name is Amy, and I'm going to be your nurse today. How are you doing? And she says she's doing good. I hear we had a healthy baby girl yesterday. She says yes. I said, well, do you mind if I just verify your name and date of birth? And she goes ahead and verifies her name and date of birth. So did everything go okay yesterday? She says, yeah, for the most part it did go okay. Good. And I see you had a vaginal birth. And she says, yeah. Did you end up pushing very long? She said, no, it actually went pretty smooth once the water broke. Well, that's great. Are you having any pain today? On a scale of 0 to 10, how would you rate your pain? And 10 being the worst pain, or what you probably felt yesterday. And she says about a 3. Okay, well that's good. And if that gets any worse, or if you want anything for that, you just let us know. Are you having any problems with your vision at all? And she says, no, not really. Good. Well, have you been able to go to the bathroom? Have you been able to void or have bowel movements? And she says, yeah, but sometimes it hurts when I have a bowel movement. Well, that's understandable with the medications that you received yesterday. You might need to have a stool softener. So if you want to have your bowel movements softened up a little bit, we can give you a PRN Colace, and that will help things out. And she says, okay. Do you notice if there's any hemorrhoids or anything? And she says, I don't know. I haven't been able to tell. We do have a lot of different products that we can use. We can use the Tux pads. If you had an episiotomy, did you have an episiotomy? And she said, yeah, a slight one. Okay, and there's the Tux pads or the Dermaplast if you want to use any of those. Okay. Now, Jane, before I get started, I'm going to be doing a head-to-toe assessment. Is there anything that I can do to make this easier, or is there anything that you need before I do this? And she says, no. And are you getting pretty excited to see baby? She says, yeah. Are you getting excited to go home, and do you have a lot of help there to help with all that? And she says, yeah, my husband is going to be there and my mother-in-law. Well, that's great. I'm glad you have all that help. Well, we'll make sure that we have the car seats is all in place and get all that started. But today I'm going to do a head-to-toe assessment. We're just going to check you out from your heart and lungs we'll check your breasts. Are you breastfeeding, or are you going to do a bottle breastfeeding? Okay. Well then, if you feel like it's engorged where it feels large, that in a couple days your milk will actually come in, because the first couple days is just your colostrum. So then once your milk starts to come in, it might feel a little bit engorged or large, and then your nipples could get a little dry or cracked and red, so we can get that taken care of. All right, so let me go ahead and just get your vitals. So I would go ahead and get all of her vitals: blood pressure, respirations, oxygen, temperature, making sure she doesn't have an infection of any kind. And then I'm also going to listen to your heart and lungs, and all of her oxygen level was great. Her blood pressure was amazing. So I'm just going to take a listen to your heart and lungs here. Go ahead and take a deep breath for me. So I'm going to listen to the heart and lungs, and everything sounds really good. Take deep breaths for me. I'm going to listen to all 4 quadrants of her bowels. Everything sounds good there too. Wonderful. Good. So I've listened to her heart, I've listened to her lungs, everything sounds good. I've listened to her bowel movements. Everything sounds good. She says that she's been voiding. She's been having a bowel movement, but a little hard time doing so just because of her episiotomy, so I've offered the stool softener. So we've taken the blood pressure, we've taken her temperature, making sure that there's nothing abnormal going on. We've also checked her radial pulse, and I'm just going to make sure that they're the same on both sides. We can check the brachial pulse, making sure that they're equal on both sides, and everything looks good there. So then I'm just going to go ahead and I'm going to throw some gloves on here. And I'm just going to do a breast exam on you, and we're just going to check for that engorgement that we had talked about, and looking at the nipples to make sure that they're not cracking or infected, okay? So I'm just going to take a peek here, and I'm going to use the back of my hand, making sure that it's not engorged, checking out the nipples, making sure that they're not red and cracked. bleeding and they look good. And then I'm just gonna pull this down here. And I'm gonna just take a look at your tummy here. Now you let me know if it feels uncomfortable at all, okay? And I'm just poking around, making sure that the uterus is midline. It's U-1, and it's firm. Good. And then while I'm here, I'm just gonna take a peek at your peri-pad here. And I notice that I'm looking at her episiotomy here. We do the Rita. I'm making sure that there's the redness. There's checking the edema, checking for bruising. Doesn't seem to be any bruising. Making sure that there's not excess drainage or the approximation of the laceration is okay. I'm also taking a look at her peri-pad. Looks like she's got scant amount of lochia. It's rubra red, and that is normal for now. So we're looking good there. And then I would get her a clean pad, making sure that she stays clean there. And then while I'm here, I'm just going to take a look at your legs here, okay, Jane? Take a look at her legs, making sure that they're not tight or red, edema going on. And then I'm going to come around here and I'm going to do capillary refill. Looks good. Now we're going to do the Homan sign, making sure she doesn't have any pain in her calf when I do that. So that's good. And then I'm going to have you, if you could, we're just going to have you turn on your side, and I'm going to check your bottom for any hemorrhoids, if that's okay. So we're going to just roll her over here. Just roll over, provide coverage as much as I can. Alright, and then we would just check her bottom here, making sure that the laceration didn't come all the way back to the anus. And then I'm also going to make sure that she doesn't have any hemorrhoids. And as of right now, I don't see any hemorrhoids, so that's great news. That's good. Get you covered up here. Perfect. So as of right now, I've done the acronym bubble pleb. We've checked out her breasts, we've checked out her uterus, making sure that that's good and making sure to support it at the same time. We've made sure that she's voiding both bowel and bladder. We've checked her lochia, which is rubra red, scant, nothing abnormal there, so we're doing good there. And then we've also checked her emotional status, her bonding with the baby, any cultural issues that she may have. So we've done the whole bubble pleb. She looks good. And Jane, if you don't mind, I'm just going to step out and I'm going to go do an assessment on your baby girl, okay? And she says, yes, that's fine. I'm going to do hand hygiene, and thank you.